Patient assessment and nursing intervention plan. Subjective data. Client complaints. The patient complains of dry cough, decreased appetite, shortness of breath, and low-grade fever. The woman also reports a slight sore throat. HPI, history of present illness. According to the patient's HPI, the woman has been suffering from a dry cough and decreased appetite for the past 2 weeks. Meanwhile, she does not report any cases of nausea or vomiting. The cough is particularly acute in the nighttime, while the sore throat mainly troubles her in the morning. The described symptoms have worsened within the past 2 days. The woman is concerned she might have heart problems or pneumonia. PMH, past medical history includes current medications, any known allergies, and any history of surgery or hospitalizations. The patient has refused to take the prescribed inhalers or to undergo hospitalization and pulmonary function tests. When the symptoms worsen, she takes the prescribed antibiotics. The last chest investigation discovered emphysema. The woman reports an allergy to sulfa drugs. The associated reaction is rash. Significant family history. The patient has been single for the past 20 years. The woman has 2 daughters, but they do not visit her often. She also has 2 sisters diagnosed with osteoporosis and breast cancer. Social and personal history, occupation, lifestyle, diet, exercise, substance use. The woman receives a regular pension of $40,000 and uses the savings. She has her own house. Her lifestyle is reserved and stress-free. The major social activity is the patient's visits to the church community. The patient does not have unhealthy habits except for smoking and is involved in sewing. She does not consider any other activities due to the low awareness of the community resources. Description of client's support system. The patient's support system is composed of the primary care provider, her 2 daughters, and the church community members. The former 2 do not have time for frequent contact. Behavioral or nonverbal messages. The woman experiences depression due to her reserved lifestyle and rare social contacts. The self-efficacy perception is low and keeps decreasing. Client awareness of abilities, disease process, and healthcare needs. The patient has a low awareness of community resources and healthcare options. She aligns the present symptoms with heart problems and pneumonia, though there is no medical evidence proving the assumptions. She does not take the prescribed medications, due in part to the fact they are not covered by the insurance, and partially because of her poor awareness of their effect. Objective data. Vital signs. Blood pressure, 130/72, left arm, sitting, regular cough, temperature, 101 degrees Fahrenheit, pulse, 100 BPM and regular, respiratory rate, 20, non-labored. Physical assessment findings. The white material on the buccal mucosa was discovered in the HEENT process. No lymph nodes were found. Lung examination shows decreased breath sounds, dull to percussion right lower lobe, and increased anterior-posterior diameter to the chest wall. There is an end expiratory wheeze in the right lower lobe. No rales or rhonchi were discovered. Heart examination shows that regular rate and rhythm is without murmur. Extremities examination shows 2+ pulses throughout. No edema is discovered. Lab tests and results. Complete blood count, white blood cells 15,000 with plus left shift. The pulse oximeter reading is arterial oxygen saturation, 98%. The radiological studies show that chest radiograph is the same as X-ray. Electrocardiogram exhibits normal sinus rhythm. Client support system. From a financial perspective, it is medical insurance. From the social standpoint, it comprises her daughters, the church and healthcare communities, and, potentially, her sisters. Client's locus of control and readiness to learn. The patient might have an external locus of control due to her spirituality and resistance to taking prescribed medications. Her readiness to learn might be evaluated as high as she appreciates her contacts with healthcare workers. ICD-10 diagnoses. Within the ICD-10 diagnoses assessment, several problems should be distinguished. F50, eating disorders. The associated is related to the decreased appetite. F34, persistent mood disorders. The associated is related to lowered self-esteem and continuous depression. APN intervention plan, including interdisciplinary collaboration, community resources, and follow-up plans. Nursing diagnosis. According to the NANDA nursing diagnosis list, several risks might be identified relevant to the preliminary assessments. Within the relations dimension, the condition can be characterized as social isolation. The associated is related to the low level of social support. The diagnosis's defining characteristics are the reported feeling of loneliness and low social activity. Within the choice dimension, the inability to adapt to a change in health status can be pointed out as a risk for diagnosis. The associated related to the poor patient's awareness of the required healthcare procedures. The diagnosis's defining characteristics are the woman's addiction to smoking despite the consistent cough and her low social activity despite the worsening depressive moods. Finally, the ineffective family coping strategies, namely, the lack of substantial support, might be pointed out as the potential risk for diagnosis. The associated is related to the low frequency of family reunions and poor communication between the patient and her children. The diagnosis's defining characteristics are the patient's dissatisfaction with the current family relations and the associated feeling of loneliness. Patient goals. The key goal of the proposed care plan resides in enhancing the patient's socialization in a half-year period. The set goal comprises such objectives as raising the woman's awareness of both community and healthcare resources and strengthening her relations with family members and other support agents. It is expected that the realization of this goal will allow for improved care delivery and help the patient adopt a healthy lifestyle framework, which is one of the main targets promoted by AHRQ. Nursing intervention. A series of interventions is proposed to complete the target goal. First and foremost, it is proposed to intensify the primary care provider's inclusion. Thus, the latter should support the patient more actively by giving regular visits and providing essential clarification regarding the prescribed medications and the available resources. Second, it is proposed to involve the family members, specifically, the patient's daughters, to assist the woman in her socialization progress. To this, the nursing community should contact the woman's daughters and communicate the necessity for intense support to them. It is expected that the active participation of the family members will help the woman to overcome her emotional disturbances. Lastly, all the change participants, specifically the nursing community, the primary care providers, and the family members, need to raise the patient's awareness of the available community and healthcare resources to improve the quality of the care she receives. Nursing rationale. The effectiveness of the proposed interventions is evidenced by recent studies. Hence, in their research, Dickens, Richards, Greaves, and Campbell show that socialization-related interventions, including the intensive inclusion of primary care specialists and family, help a patient acquire positive reinforcement and decrease depressive moods, particularly in elderly people. Additionally, scientific studies reveal that patients who exhibit a satisfactory socialization level are more likely to make a shift to a healthy lifestyle as the surrounding communities provide them with up-to-date information regarding healthcare tendencies and options.